Good afternoon and welcome to our media update on this May the 1st. May the 1st, as it turns out, is Doctors' Day. So, appropriately, we celebrate doctors for their commitment to the health and well being of their patients and our community and the great work they're doing in our hospitals and clinics and long term care homes and research labs. Tireless work that is appreciated, and we're forever grateful. And so, thank you, all the doctors out there. The province of Ontario made some announcements today about following the proper health and safety guidelines in terms of opening up some of the businesses that are out there as of Monday, May the 4th at 12:01 a.m. to be precise. So some of those businesses include garden centers and nurseries with curbside pickup and delivery only. Lawn care and landscaping companies or landscaping operations are going to be allowed to open on Monday. Additional essential construction projects that include, but not limited to, shipping and logistics, broadband telecommunications, digital infrastructure, and other projects that support the improved delivery of goods and services, municipal projects, colleges and universities, childcare centers, schools, site preparation of excavation, and servicing of institutional, commercial, industrial, and residential developments, as well as automatic and self serve car washes, auto dealerships by appointment only. Golf courses may begin to prepare their courses for the upcoming season, but will not yet be open to the public. But you'll see some grounds work happening on those courses, public and private. And marinas that may also begin preparations for the recreational boating season by servicing the boats and other watercraft and getting them in the water. But again, still not open to the public. So until such time as there's a go ahead to say it's good to go in terms of getting those boats out in the water, not yet open, but getting prepared to get them ready for service through the recreational boating season. We're still awaiting further clarity on the province's 4-hour top up announcement for eligible frontline workers. We really need to better understand how that funding will be administered and the city's role within that process. So stay tuned and we'll get some more additional information to clarify that. As of last week, the announcement also provides for a monthly lump sum payment of $250 for those eligible employees who are working over 100 hours per month. So stay tuned for those payments are in effect for 16 weeks from the period of April the 24th to August the 13th, 2020. We announced a couple of weeks ago that the availability of provincial funding that the city would allocate on its behalf via an application process for community and social service agencies to apply for funding to support the COVID response efforts. I can share with you that funding is now being allocated to 8 community agencies. We're in the process of allocating that funding to them likely next week or so, and we're continuing to review applications on a weekly basis. So that's good news that some of that funding is getting out the door and helping those agencies and organizations. As always, more information on all of that is on the city's website, outlining the various financial supports available to individuals and families experiencing challenges due to the COVID-19. So visit hamilton.ca/coronavirus/financial-support-individuals. You'll find it on our website, and all of the available information for you in terms of how you make those applications is there. Some city updates. Council approved putting together an economic recovery task force. Our economic development and tourism and culture team are going to develop a terms of reference and report back to council for the creation of this task force that will hopefully help position the city for a short-term and then longer-term economic recovery through this COVID-19 pandemic process. It'll be made up of representatives from local business, labor, industry, and academia. I imagine BIAs will be represented there as well. And the whole idea being let's help facilitate the renewal and getting back into business. All the businesses that have been shuttered up until now, hopefully they can all return, and they'll have issues, around financing, around personal protective equipment, a whole range of issues that they're going to have to sort through. And we want to be able to be available to help them through that rather than letting them individually have to sort that out. Hopefully we can create some sort of a best practice process that will help each individual business speed that process along. So we're looking forward to making that happen for our community down the road. All seat and city-run events and facility bookings are canceled through to July the 2nd. I am sorry to say. So a seat being all special event advisory team events that go through the application process. Those events are canceled, and any city-run events and facilities and bookings are canceled as well. So we'll not take any bookings for at least that time period, and until we have a better sense of what the reopening plan looks like, we'll have a second look at what it looks like beyond July the 2nd. And customers and event organizers have been advised of this directly, and we continue to work on also a virtual plan for Canada Day celebrations. Speaking of which, again, a tradition that we're well accustomed to, but will not be happening this year. There's going to be a fireworks ban. The EOC has directed the fire chief not to issue permits for the sale or display of fireworks through to July the 4th. Secondarily, there will be a bylaw amendment regarding fireworks, which will be brought forward to council on May the 13th. So sadly, there won't be a dramatic fireworks display this year. We're going to have to set it off to another year, but still find a virtual Canada Day way to celebrate, and we'll keep you posted on how that happens and gets developed going forward. As you also know, the community gardens can reopen now as long as the comprehensive guidelines are established by our public health team. So please have a look at the website for those additional guidelines in terms of how you can put that into effect. But obviously, people will be anxious to get out there this weekend, but you do have to adhere to those guidelines, and they're on the city's coronavirus website page. Bylaw officers will continue to enforce social distancing. The weather's going to be nice this weekend, and I know the tendency will be to relax and go and do all those wonderful things that we all want to do. But unfortunately, we've come this far, and we're doing successfully well. We're doing extremely well based on not having this spread of virus overrun the healthcare system. But we need to continue on. We're not there yet. And so don't relax now. Well, let's not have a spike as a result of relaxed tendencies over the weekend. So maintain your posture right now. Stay home as much as you can, and stay as close to home if you need to get out. And if you need to let the dog run, let him do it in the backyard, and maintain that physical distancing as much as you can. And please try and avoid going to some of the places that have been a challenge going forward. Now, Albion Falls and Devil's Punch Bowl, many of the other waterfalls, in fact, they're all closed, and they're closed for a reason, is that it will prevent people from congregating together and prevent the spread of this virus, which is still very much out there and hasn't disappeared and still continues to be a problem. So be mindful of that, and stay away from these locations. Do other things other than visiting our waterfalls or our major conservation areas, trails. All of them are closed, including Battlefield Park. And we've unfortunately had to ticket some people that are using the golf course as a leash-free park for dogs. The golf courses are closed. They're only now slightly opening up to do some maintenance for our public works workers to prepare for a future opening. But as of now, they're closed. They're not intended to be a place for walks for dogs or anyone else. And so please adhere to that. And Battlefield Park, as I mentioned just a minute ago, we've had people over there having picnics, using all the equipment that's available there. The park is closed. Please do not use the equipment. The whole idea is to not gather in groups and potentially spread the virus. Private property, anywhere else in the city in terms of dogs. So dogs are to be on a leash at all times. And so there is no place other than a dog park. And unfortunately, all the dog parks are closed for the same reason, to avoid people from congregating there. The dog parks are closed, and you are to have your dog on a leash at all times in all places. So our public parks are not the place for you to let your dog have a romp and a run. You never know, who they might run into. And for anyone that isn't a dog owner that gets, charged at by a dog who may not know whether the dog is friendly or not, that is not what you need to let have happen. Keep your dog on a leash, and there is fining associated if you should fail to do that and you are caught by our bylaw enforcement officers. So it's a $100 fine, not something you want to expend just because you decided to unleash your dog for a moment or two. The violation under the Emergency Measures Act is still very much in place, and that carries a fine of $750, which is really, when people are gathering in groups of more than 5 people, and we've had occasions where people have had home parties and larger gatherings. Well, the fine is $750 if you're found out to be doing that. And you can rest assured that there are many neighbors keeping their eyes out for people that are not maintaining the rules that were currently in place for our own protection and protection of others in terms of the spread of the virus. So don't do it. Please don't do it. This is not the weekend to do it. Save that beer party for another day. That day will come, and hopefully not too far down the road. I do want to acknowledge that the paramedics are acknowledging a 9% drop in their services and their required services over the March and April time period, which is a little concerning because that essentially means that far too many people are not calling for critical care services as they should, and potentially because they're concerned about a virus in hospital or in other places. You should not call the paramedic services. If you're having critical health issues, call immediately, get the care you need. There's no sense dying over a healthcare issue because you're afraid of a virus. You're well protected in the hospitals, and so please do attend to your health needs as you always would in normal circumstances. Do not put it off. Make sure if there's an emergent issue for you, get a hold of the paramedics or your doctor or the emergent care areas and get the help and assistance you need. Don't leave it to others to do. I'm going to turn it now over to Paul Johnson for some updates from the EOC, the Emergency Operations Center. And after that, Dr. Richardson with some critical details on how we're doing in terms of public health. Paul?
Thanks, Mr. Mayor. I'll be very brief. As an EOC, we want to continue to remind the public that although there's lots of talk of reopening, and you are seeing some additional businesses being offered the opportunity to provide service to the community, much of the restrictions are still in place. We're asking people to stay at home, stay close to home, really only go out for essential activities. And we are working through what reopening will look like once we get some further direction from the province. So although we're inching towards an opportunity for us to look at having more things available, as the mayor has pointed out, all of those same things that you become accustomed to in terms of what's open and what's closed. The vast majority of that has not changed, nor will it change on Monday when certain businesses are provided the opportunity to open for business. So very limited new businesses there. And in terms of city services, outside of the fact that we continue to maintain certain assets like our golf courses and our parks and things like that, we are not ramping up an opening of services at this particular moment in time. I do want to pass on my personal thanks to all of the organizations that are working hard in the city to provide services in a variety of different ways. And of course, we focus on certain vulnerable populations, but I can tell you that the applications that we received for the funding that the mayor talked about earlier are a wide variety. People are dealing with health issues, not COVID-related health issues all the time, but health issues, but are running into barriers because of COVID in terms of getting to appointments and doing some of the other things they need, through to the food that's so critically important and some of the other services to help people through this. And also really pleased that a number of small, more what we would call grassroots organizations are taking this opportunity to help out. We need everybody across the board. You've heard us talk about our work with some of the major social service organizations in this community, and we certainly couldn't have done things without them. But it's great to see all of these organizations in the city stepping up, and we're so pleased that we're able to quickly turn around the applications and get some funding out the door so that they can keep things working along as well. And with that, I'll pass things over to Dr. Richardson.
Thanks, Paul. So I'll give a short update as well today for myself. We have 439 confirmed cases today as of noon here in Hamilton. 432 are lab confirmed, 7 are probable. There are, of course, lots of other details that are available on our website about the status of the cases and all of that information. 261 of them are resolved, and as our epidemiologist, Steph, said today, we're starting to see the pace of the resolution, the number of cases that are resolved, start to exceed the pace at which new cases are happening. So that's good news. We're up to nearly 60% of cases that have recovered. We do have 20 deaths in total, unfortunately, due to this illness. And of course, we still have outbreaks going on in our institutions. We have 10 institutional outbreaks and 3 community outbreaks that are going on. Again, more details about those can be found on our website. You know, the mayor and Paul have said a lot about the fact that we're still in this situation where we need to be following the guidance, where we need to be taking those measures. We need to be covering our coughs. We need to be staying home if we're sick. We need to not be going far from home when we venture outside, and certainly getting out on sunny days like is happening this afternoon is something that's really good for us in our mental health and our physical health. But please do stay close to home. There have been such tremendous gains made through the collective action that everybody's been taking here in Hamilton, and we want to make sure that we continue to capitalize on those and particularly protect those that are most vulnerable. We've heard too about the opening up of some new businesses that we can start to move forward on May the 4th. There is guidance that is published as well to go along with that on the Ontario website. And this is part of the efforts that are being made so that business can open safely, so that workers know what they need to do, what employers know what they need to do, so they can work safely in this new normal, because we're not going back to the way things were, where we just carried on these continued guidance around physical distancing, the importance of washing our hands. All of those things are going to continue on in this new work environment. So it's going to take the patience of everybody and the innovation of our workplaces in order to implement these guidelines in a new way so we can start getting back to business. Thanks very much. Over to you, Mr. Mayor.
Okay, thank you. And I could reiterate that the city as a whole, you have done a terrific job in getting us to this point, and to let up now would be very unfortunate. I think everybody understands why, and that level of discipline you need to maintain now for the next period to ensure that we don't see a spike here that will kind of alter and get everything to start closing up again. So we don't want to go there. And so, so far, so good in terms of success. And as we see the province starting to relax things a little bit, that's certainly not a bad sign. That's a good sign. And if we stay on this path, I think we can relax things a little bit more into the future. So hopefully we can get to some semblance of normalcy not too far down the road. Some good news stories from the city as a whole. My alma mater high school, Sir Winston Churchill Bulldogs, raised $1,500 to purchase football uniforms, but instead of buying football uniforms, they decided to donate the money to Hamilton Food Share. So I know how much football means to young high school football players, but their heart's in the right place, and they're putting the money where it needs to be right now. Obviously, football uniforms can come another day, but this food is needed right now. And so I want to thank Sir Winston Churchill Bulldogs for their generous donation. Thank you for all that effort, and go Bulldogs, go. Thanks to the volunteers with the Dundas Community Service. They're helping out during this pandemic as well by driving seniors to medical appointments, and they're delivering groceries and helping out with Meals on Wheels deliveries. They're placing phone calls to check in with seniors just to see how they're doing. All of those are volunteers with the Dundas Community Services, helping individuals in their community that might have some difficulty helping themselves. So thank you, Dundas Community Services, and all the volunteers that participate in that. As well, thank you to the volunteers who are helping Hamilton midwives. Midwives were short of disposable isolation gowns, and where it was impossible to obtain them during this pandemic. So the word went out to volunteers who sew to make the gowns out of bed sheets. And so initially they were hoping to get 45 gowns, but more than 100 came in. So allowing Hamilton's midwives to share with midwives in neighboring communities. Thank you to all of those that were sewing to help make that happen, for all the volunteers that made that happen. I mean, very, very generous approach, and midwifery is popular and important. It brings all of our newest arrivals into this world, and we thank them for their work, but they also need equipment and supplies, and you've done your part in helping make that happen. And lastly, a very generous donation from the Patrick J. McNally Charitable Foundation. They put some $100,000 into the Hamilton Food Share, the women's drop-in programs, as well as Carol Ann's Place and Willow's Place, and Womankind. And I'd like to thank Councillor Farr for making the connection with the McNally Foundation to channel their donation and charitable giving to those various organizations. So thank you for that, Councillor Farr and the McNally Charitable Foundation, for your great work. As always, we thank our American Sign Language interpreters, Rosalie Vizers and Georgia Whalen. Hopefully, I am not going too fast for them right now, and if I am, you can just wave at me. Cable 14, of course, Bill Custers and the entire team, each and every week, a couple of times, 3 times a week, are helping us broadcast this. McLean's Media, that is also ensuring that we have availability and as smooth as possible out there in the broader community. And we continue to thank our essential service workers, our paramedics, our healthcare workers, police officers, grocery store workers, pharmacists, truck drivers, cleaning staff, janitors, bus operators. I'm going to do a special shout out to the Costco front desk checkout service that I visited the other day. We were wondering why they weren't getting the $4 benefit. Good question to the premier to ask, and I'll share that with him. All of you are stepping up, and you're up on the front lines and putting yourself at risk every day. And we appreciate your desire and willingness to keep our city functional, fed, working, and keep our people that are getting sick getting the proper care that they need and deserve. So thank you for all of your work, and of course, do tune into the Hamilton.ca coronavirus website for all of those special needs. And I think at this point, I'm going to turn it over to Jazz and ask for some media questions before we wrap up. So I'm sure the media is there. So thank you for listening in, and I'll check in with you again in a few minutes. Turn it over to you, Jazz.
Thank you, Mr. Mayor. We do have a number of media partners on the phone today. As usual, we'll do one question and one follow-up for each of you. First will be Samantha Craigs from the CBC. Go ahead, Samantha.
Hi there. Thanks for taking my questions. My question is really to anyone who wants to answer, maybe all three of you. Are you worried now that we have some lovely weather, and are you worried? And there have been a lot of different stories in the media, maybe even some mixed messages about the ability for society to open up. Are you worried that this weekend people are going to sort of think, oh, this is all better, and stop following your advice?
Well, let me start, and I'm sure the doctor and Paul can chime in as well. I mean, I'm not terribly worried. So far, by and large, the city has done what we've asked them to do, and I think by virtue of the information that's been shared both at the federal, provincial, and our local level here, people understand why. They know that this virus doesn't have a cure, doesn't have a vaccine, can be potentially harmful for anyone, and especially so for seniors or people with underlying health issues. So people have died as a result of this, and you don't have to look too far to see where it's gotten out of hand. When you look at Italy, or you look at New York State, or New Orleans, places where they just weren't able to get on top of the issue as quickly as we did, and the community at large hasn't adhered to the recommendations that we've been putting out in terms of physical separation and staying home as much as possible. As difficult as it's been, I think people understand the effort that's been made here. We've been at it now for a couple of months. To relax now would be tragic if all of a sudden we now see a dramatic spread in our community where we have to again shut everything down and start all over again. So I think people understand that. So I'm not worried about it. We will be vigilant in terms of the bylaw enforcement officers and police being out there to ensure that people comply. Again, we're not looking to fine people per se. This is not a fundraising opportunity. This is an opportunity for people to do what they're asked to do, which is to protect one another and themselves from potentially contracting this virus and then spreading it to others. So I remain hopeful that the vast majority of our citizens understand that. So far, that's been the case. And I expect that even though the weather's going to be nice this weekend, that the vast majorities will still understand that and still appreciate the fact that we're not out of the woods yet. Doctor or Paul?
Mr. Mayor, I think you said it well.
My other question I wanted to ask Mr. Johnson, what is the most pressing issue that you're dealing with at the Emergency Operations Center right now?
So two things. One is we continue to look and figure out how we're going to deal with congregate settings in the city, and a lot of that's being handled through partnerships with our healthcare community. But an awful lot of that comes also back to homeless populations. And so we continue to work each and every day to ensure that we can provide the right kinds of service to that population, and in partnership with hospitals and public health and all sorts of other folks on the ground, make sure that we're providing the right support to things like residential care facilities, retirement homes, and long-term care facilities. And that is really still where there is a significant health need and a significant health risk, because by their very nature, congregate settings pose some unique challenges that need to be overcome by really good infection prevention controls that are put in place, and a physical distancing, which quite frankly, in the case of homeless shelters, just wasn't there when we started in this crisis. So that's why we've gone to some of these other pieces. So that's a big part of our work. And then the other piece is turning our minds to what service delivery looks like in the coming weeks and months as things do reopen and the city starts to, not open up all its facilities, but certainly try and get back to some services being open. And you've heard Dr. Richardson talk at length. It's not the same. It's not the same way of delivering. So it isn't just that certain services will open and others won't. Even the ones that open will be delivered in a different way. And for our staff and for those who utilize those services, life is going to be very different. And just like businesses will have to figure out how to deliver their services differently, we do too at the city. And that is an awful lot of work. And it is work that we started last week and continue in earnest, or started, sorry, this week, and will continue in earnest through the next couple of weeks, so that we have all of those machinations of what it takes to run a city ready for when we start to reopen those services.
Thanks, Paul. Next question will go to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions today. The first question I wanted to ask is about the businesses that will start to be able to reopen. Is there something at the city that will help them to determine how safely to reopen? Is there someone that will be making sure they are doing, following whatever rules are in place? Is there worry that this could be a cost to this? And is there a place they can get help with that? Like, can you talk about what services will be available to businesses as they try to reopen?
I'm just going to quickly kind of reiterate that we are, developing the Economic Recovery Task Force. The whole purpose behind that is to facilitate the gathering of information and the resources required for people to open their businesses, and that it would include, if they need it, business advice, personal protective equipment that is likely going to be required, and how can we help resource all of that to make it quicker, easier, more streamlined and more organized, including best practices that are going to be espoused by both federal and provincial authorities in terms of how we do start to open, relax up some of these businesses. But on the short run, I think Paul should answer some of the guidelines that are going to be out there in terms of what these new openings on Monday would include, and where people can get information on that in terms of what guidelines they're going to be required to follow. Paul?
Well, certainly we saw the provincial government release yesterday a series of guidance documents for businesses. And so I think the province has been very clear. They're hiring more inspectors. They're providing guidance to businesses so that there can be some consistency as some of these businesses open up. Of course, they're businesses that are shared across, they're not unique to Hamilton or unique to Kapuskasing or unique to somewhere else in the province. They're things that people enjoy in every community. And so having them delivered in consistent ways will be really important. From a local perspective, I would say that, and I'll let Dr. Richardson, confirm this, but I think, part of our exercise of working together is to see how those provincial pieces will be translated locally. And I know that public health is consulted all the time by business. So this won't be new in terms of providing support to businesses. We're there both as a gate that oftentimes businesses have to go through, and certain businesses when they're setting up need certain approvals from public health. But the other side of that is a public health is available to help with some of those questions. And we see a real working together alongside the task force, alongside our own economic development department and businesses in the community. And further to that, and I'll let Elizabeth comment because I didn't get a chance to listen in, but Dr. Richardson was a guest, for instance, in the Chamber of Commerce, one of their town halls. So maybe Elizabeth, you can just share a bit of what you're looking at from public health.
Absolutely. Thanks, Paul. I think, as we go forward, it really is going to be that collaborative approach. You've heard the mayor talk about the task force. We're looking at how we can help to support business as they move forward. We know there's going to be a fair number of questions, and we've had questions all the way along because not only have things closed down in a sequential way, but they've also had had a whole lot of businesses that actually have continued to operate throughout and have had questions about how things work. So we answered a lot of those questions this week on the Chamber's session as we were able. The guidance, I think, is going to be really great in terms of providing specific industries. It is specific guidance that helps them understand what it is they need to do in terms of maintaining physical distancing, all those sorts of things, recommendations about things they could do in order to make sure their workers are safe, their clients are safe, it's a safe environment for everybody. So we'll continue to support that as we go forward and see what it is that we find they need as we go.
Thanks so much. And Dr. Richardson, my second question is for you. Today, the province provided some flexibility to help manage healthcare resources. Do you know what this will mean for Hamilton? Like, do you have any idea how this might be used here?
Hi, Joanna. In terms of that flexibility, it's something we're just still digesting and understanding how it works for us. There's been a fair amount of information come out in the last couple of days, and so we're just getting to understand it and see how it might work.
Thanks, Joanna. Next question will go to Matthew from the Hamilton Spectator. Matthew, you can go ahead.
Can you hear me?
Yes, we can. Go ahead.
Hi, folks. Paul, I think this is probably a question to you or a question to the EOC anyway. I know the city has been working very hard to connect homeless residents with shelter and services over the last, well, for quite some time, and in particularly during our pandemic period. But it looks like not everyone always takes you up on those offers, and it's ongoing work. But I talked to some homeless residents today who said that they were forced to leave, obviously, the Sir John A site earlier in the week. They moved to a local city park, and now they're being told they have to move again. So I was wondering, why is it necessary to actually have that threat of eviction when they're set up on city-owned land?
So there's no eviction rules that exist for camping on public property or private property. So I think we have to be careful in language a little bit. The city is not at this stage investigating any opportunity to sanction setting up of large tent cities. There is no staffing model that would provide 24-hour support and safety to that type of a setup. And we actually have shelter space available. We have hotel space available, and we are more and more connecting people with permanent housing. So that's been our approach. If we do not call the police the minute we have somebody say, hey, there's an encampment somewhere, and have the police come and do something. That's not the way we've worked from day one. And quite frankly, it wasn't the way we were working before the pandemic. We have outreach that happens. We get out and we talk to people about opportunities and options. And we work very hard, and we're very successful in the case of Sir John A. Macdonald of connecting people with shelter or with other types of accommodation around that. And so that's going to be our continued approach. And I think that, when you think about safety, we only need to look at what happened today in Toronto in one of their encampments and understand that it's not always safe in an encampment. We need to get people into housing. That's the goal here. And we continue to work on that path and will. And in fact, we're looking at adding some additional resources to our mental health and street outreach team in order to further support their efforts, because this is happening in a few more locations or at a different volume than we've seen before. And the reality is that there's more challenges in making sure that we don't overload certain shelter. We may have to look at hotels as we have in certain cases. But I'm also really happy, and kudos to our housing services division, that they're working with social housing providers again to start up in earnest the ability to move people into permanent housing. And that will help also allow some people maybe to vacate hotel spaces or shelter spaces and allow people to go in there if that's most appropriate to stabilize them, or allow people to move directly into some form of permanent housing, which is ultimately our approach. So we believe there's capacity there. This is still our approach at this stage, and we'll do everything in our power to open up spaces that are inside and in an appropriate way to deal with the issues that people have who find themselves homeless.
Okay, just as a related follow then, I had heard from some local outreach groups that I think had been helping out on the ground at at Sir John A. And they were under the impression that the folks who couldn't be immediately accommodated or who wouldn't be accommodated, they were encouraged to go to city-owned property in the interim because it would be easier for the city to be flexible with them. Did they misunderstand, or was there some sort of direction of that nature?
Well, the reality is on private property, the city can't control timing, period. A private property owner could simply phone the police, and there are things that happen. There's no way for us to stop the enforcement of things on private land in the same way we can't step in and do that. So I use the example of if someone was, setting up an encampment in my backyard, or a resident's backyard, maybe not mine, I might have a different approach, but a resident's backyard, would we simply say, well, you need to stay there and allow that to happen for several weeks? So private property is different, but never was it that you go onto public property and that's where you can stay through the duration of this pandemic. It's the same issue. We do need to maintain our public spaces as well because they're used by other people. And as I say, our primary focus is to get people into shelter, safe shelter, and then into more permanent housing. And I understand that that's very complex. I mean, this is where I started my career, and it's never easy. And anyone who suggests that there is a one-way solution to this, simply hasn't worked in this field. It is something that is complex, and we work every day. And so I think some of that commentary was, we're always fearful because we want to use the right approach and we want to use an engagement model of it. We do set some deadlines, but that's so everybody is working towards solutions. But just be real clear, on private property, the city won't control that timing. And that is where we've also had some communication to say it's not a wise idea to have some of these start and get bigger and bigger on private property, because those owners may exercise some of their rights, and quite frankly, they have some liabilities that they may not be as comfortable with. So it is a very complicated scenario, but I can tell you that assuredly, the city is not saying go onto city property and remain in an encampment scenario throughout this pandemic. We will be engaging there, and we will be helping people to find the right connections as best as we possibly can.
Okay.
Thanks, Paul. We have one media partner left on the phone. The last question goes to Joey Coleman from the Public Record. Joey, you can go ahead.
Dr. Richardson, on the excess deaths, are your epidemiologists tracking year over year the number of death certificates issued, and are you noticing any changes in trends?
In terms of death certificate data is actually really difficult data to work with because it actually comes very late in the process. And so we actually use other data to track things. Overall, morbidity, mortality, information that comes through, for example, with COVID-19, we're getting information directly in patients that we're managing as we go. I'm not sure exactly how the coroner will handle it going forward in terms of putting information together. They're very actively looking at how do they classify deaths in this situation, because as some might know, there's people who might die during this time frame that happen to be infected with COVID, but they may not have died of COVID. There may have been other reasons why they passed away. So it's always, in Ontario, we're very lucky to have that system. Others don't have that degree of detail in it. And so that helps us to understand the bigger picture, but the data itself tends to lag behind. So we are using the information sources that we do have, the ones that you see up on our website, to look at what are we seeing overall, and we'll continue to track that. We have a 3-stage sort of data review process, the data that's looking at COVID itself and looking at some expanded indicators about what's going on in our community, particularly around mental health and those sorts of issues. And then we're expanding on that with additional data from police and from our paramedic colleagues to look at the broader picture of what's happening within the community. And then we're going to really only be able to do in retrospect after some time in terms of what all of the impacts may have been. And so that's going to come a little further down the line.
So to clarify, it's my understanding of the Vital Statistics Act that a death certificate must be applied for with the local records office within 48 hours of death. The cause of death may not be known. So my question is the city tracking the number of death certificates that it's receiving application for and able to look year over year to see if there is a significant deviation from the normal averages?
That's not a question I can answer in terms of what our vital statistics section is doing. I can only tell you how we utilize the data once that data is filled out from a more complete standpoint.
Thank you, Dr. Richardson. We'll pass it back to you, Mr. Mayor, for some closing remarks.
Okay, thank you. And to follow on that, I mean, again, I'll reiterate that the paramedic services is one indicator that they see a reduction in their use that may indicate that people are not calling them the way they have in the past for emergent issues, and we encourage them to do so. So we don't want anyone to not get the medical care or attention that they need or deserve, given whatever medical condition they're challenged with. Be sure to call your doctor or get a hold of 911 or call the paramedics if you're in need of healthcare issues that need to be attended to do immediately. Don't not do it because you're worried about the COVID-19 virus. As well, we have mental health issues in our community that are, can be amplified at this point in time, and we encourage people to get a hold of the Coast Assistance hotline at 905-972-8338. Just to define COAST a little bit, it's police officers and paramedic healthcare workers that are prepared to speak to you on issues that you're dealing with in terms of mental health, so you can get the help and care that you need, as well as the Kids Help phone line, which is available 24/7 at 1-800-668-6868 or text at 686868. Kids Help phone line for kids that are having either mental health challenges or domestic challenges in our community, need someone to talk to and help through. There's help at the other end of the line for you as well. How can you help in terms of some of the critical needs that are out there is by donating blood. Critical surgeries are still happening, and we expect that more will continue to happen. And so blood service and blood plasma requirements are still a very important need. And so if you can get to the blood.ca website for the Canada Blood Services and make an appointment in your local blood donation clinic, they'll be happy to take your plasma to help save the lives of others in critical need surgeries as we go forward. As well, continue to check in on your neighbors. If you can donate to the local food bank, if you have those kinds of resources, please do. The need is great, and every dollar that you donate to the food bank can be turned into $3 worth of food that can be shared with those in need in our community right now. And of course, the need has grown as a result of this pandemic. So please, if you can, do what you can. And a reminder as well that all counselors and staff are available and working. And even though they're working remotely, they're available at all their usual numbers that you can find on the website, both emails and phone numbers, as well as their staffs. They're ready to help you with whatever need that you or question you might have, as is my office. You can call my office anytime at 905-546-4200. Lastly, Council approved through the encouragement of Councillor Farr and Councillor Jackson, and unanimously approved by Council to help support our Muslim friends in our community through Ramadan, to have a call to prayer twice a day until May the 23rd, which is the end of Ramadan. So at noon, for 2 minutes, you'll hear the call to prayer over the microphones at the mosques, both on the mountain and at the lower city, and just before half an hour before sunset, you will hear the same. I know it's going to be a very special opportunity for the Muslim community that cannot get together or should not get together to celebrate Ramadan as they normally would. And this is just one way that they can still feel like they're connected and together and that their community is behind them. And certainly Council unanimously supported that to help celebrate not only the religious institution in Ramadan, but to do, to make a declaration around, Hamilton is for everyone. We include everyone, no matter what your religious belief, no matter where you come from, you are welcome here in the city of Hamilton. That's what our immigration strategy is all about, and that's certainly what helping the Muslim community celebrate Ramadan is all about as well. And that's it for this week. We wish you a great weekend. And again, a reminder, this is not the time to relax, although we want you all to enjoy the sunshine in your backyards, and I'm sure a lot of gardening will be happening. That Leaf and Yard program is still up and running on a week-to-week basis So bear that in mind when you're collecting your leaf and yards that you need to dispose of. You can still also dispose of that at the transfer stations. All you have to do is drive it in. It doesn't cost you anything, and drop it off. Beyond that, have a great weekend. Thank you again for everything you're doing out in our community here. The work that you're doing has made a dramatic difference in the amount of cases we've had in our community. And if we continue to do that, the sooner we can get to a more normal state of existence and start relaxing the very important businesses and activities that we all want to get to enjoy the spring and hopefully get on to a great summer. And so thank you all very much. Continued good work, and we will see you on Monday for the next media availability and updates on anything new that's come out that we need to share with you going forward. Have a great weekend.